Hi, everyone. My name is Amanda Hagendorf, and I am speaking on the Foster Care to Prison Health Line and how it is reflective of health disparities in our country. So, when we think of Newton's third law of motion, it states that an object in motion remains in motion hither to its surrounding forces. If we think of the gravitational orbit of planets or atoms, we can see that the positive, negative, and neutral forces all contribute to the path of an object. If you envision the growth of a flowering plant, you can think of the way that sunlight affects the blossoms, the way that rain affects the leaves, and the way that rocks under the soil affect the growth pattern of the roots. Our decision-making process is very similar to this. How does our decision-making process resemble the orbit of the solar system or the growth of a flower? Well, as stated in Newton's law of motion, we are in motion hither to our surrounding forces. Ideas and beliefs that we are introduced to as children become our central light. Our experiences in life provide knowledge that is used to form our own thoughts and opinions, and the people around us help to form our environment and guide our path. In an ideal scenario, these forces are all in balance. The planets orbit without collision and the flowers bloom. But what happens when there is interference? What happens if there's a large impact, knocking a planet out of its usual orbit? Or if a drought occurs, what becomes of the plant? The same thing that happens to a child whose needs are not met. So let's think back to how our surrounding forces impact our decision making. It is arguable whether or not you can be impacted by something that you have never been introduced to. However, when an essential element is missing, growth can be impeded by its absence. The implications of this situation are that the children affected by an incomplete social environment may struggle to form intimate relationships, face obstacles in employment during their adult years, and are more likely to participate in risk-taking behaviors. Much like a plant in dry soil, a child whose fundamental needs are not being met will often search their social environment for a way to fulfill these needs. In the process, they may engage in risk-taking behaviors, their cognitive growth may be stunted, and life expectancy may even decrease. It has been documented that such childhood trauma affects brain development, the immune system, and hormonal systems through activation of the cortisol and adrenal circuits. Childhood trauma, especially the temporary or permanent rehoming of a child, also has an impact on school performance and behavioral patterns into adulthood. According to Brauffenbenner's ecological system theory, Brauffenbenner 1992, youth development is influenced by individual characteristics as well as environmental and systemic factors that are associated with academic functioning, including both performance and behavioral health in school. Furthermore, the Children's Bureau at the Administration of Children and Families stated that in 2020, over 405,000 youths were currently in foster care, and by age 17, more than 50% of these children had been justice impacted by arrest, conviction, or detention. The foster care to prison pipeline is a grave social situation affecting thousands of helpless children in the United States, and these statistics reflect the negative effects of health disparities in the country, where those in marginalized communities are unable to provide a nourishing environment for their children and are subsequently deemed unfit caretakers. Children's presence in the child welfare system can often be linked to health disparities in the community when compared to the national or regional standard. Health disparities refer to a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage, according to Siebert's 2021 publication. Youths placed in foster care can frequently come from such disadvantaged communities where they have witnessed or experienced violence, substance abuse, poverty, and/or neglect. These kinds of negative experiences, especially in the years of early development, become worked into the pattern recognition centers of the brain. Once the brain has accepted these patterns, they become part of a person's decision-making process, impacting their expectations and behavioral tendencies. Studies conducted by the U.S. Department of Justice show that students in foster care have an approximate 25% graduation rate, a number that has increased over the years. Several studies have documented an association between multiple home or school changes and below average performance in academic areas such as reading, writing, and mathematics amongst youths in foster care. In other words, foster children have a 25% likelihood of graduating from high school, which is a minimum requirement held by most employers. This outcome highlights the importance of stability and community support in the cognitive and behavioral development of youth. Statistics show that school is not the only area where foster children fall behind. Many of them struggle to form intimate relationships, face obstacles in employment during their adult years, and are more likely to participate in risk-taking behaviors that can result in imprisonment. The distinction between right and wrong is not as simple as many believe. Morals and standards are taught to us first by our immediate family and are then enforced by our cultural environment. In cases of domestic violence and substance abuse, for example, children are removed from the environment after the situation has become extreme. For someone who was introduced to these patterns early in life, it can be difficult to change these views on what is normal and acceptable without help from outside sources. Within the child welfare system, there are intervention teams with whom most children and adolescents in the system interact with at some point in their lives. The longer a family is involved in the system, the more likely it is that children and parents will become accustomed to the presence of therapists and counselors in their lives. But rerouting a child's reasoning is no easy task. It takes time, attention, and resources to successfully raise a child under normal circumstances. Considering the lived experiences of foster children, encouraging a healthy mindset becomes even more challenging. Groups such as the Child Welfare League of America, which has written the National Blueprint for Excellence in Child Welfare, attempts to provide for the needs of these children, but much more can be done. The phrase, "it takes a village to raise a child," has a special place in the conversation about foster youths. The Child Welfare League of America spearheads programs in the child welfare system and works to provide resources for this vulnerable community. Economic and emotional support for homes, traditional families, and foster families are some of their many missions. The idea of economic and emotional support for traditional families is one way that we can improve the health and well-being of disadvantaged children nationwide. Providing support to parents and potentially lowering the number of children in foster care is possible. Other federal outreach programs, such as SNAP and WIC, are in place to attempt to mitigate health disparities in the form of financial assistance to mothers and children. Given the current and estimated demographic shifts in the US population, decreasing these health disparities is imperative to ensure that the future health of all Americans prospers. The importance of stability and community support in the cognitive and behavioral development of youth cannot be overstated, as each child's support network builds the framework for their decision-making process. By addressing the issue at its source of economic disparity, we can change the trajectory of current foster children and potentially lower the number of children entering the system in the future. Thank you.